Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I want to demonstrate how to recap a needle using the one-hand scoop technique. Now you want to avoid recapping needles due to the high risk of needle stick injuries. However, sometimes as a nurse you have to recap a needle. And to do this safely, you want to use a technique that decreases the risk of a needle stick. When recapping a needle, you want to avoid using this technique as it carries a much greater risk for a needle stick injury. Therefore, it is recommended that when you do have to recap a needle, that you use the one-hand scoop technique. So I have a situation where I need to recap this needle because I have used this needle to withdraw medication from a vial, and I need to remove this needle and apply a new one so I can administer it to the patient. So I have kept the original cap and packaging to help assist me do this. So what I'm going to do is I'm going to use just one hand, hence why we call it the one-hand scoop technique. I'm going to keep my non-dominant hand by my side, so I'm only going to have my dominant hand holding the barrel of the syringe. And then carefully, I'm going to place the needle inside of the cap until I can no longer get it inside the cap. Then I'm going to lift up like this and then take that one hand that I wasn't using and just snap the cap on. Alternatively, when using the one-hand scoop technique, some protocols require that you use a hard surface to snap the cap into place without using the other hand. Then I'm going to remove and dispose of the needle per my facility's protocol. Okay, so that wraps up this demonstration on how to recap a needle using the one-hand scoop technique. And if you'd like to watch some other nursing skill videos, you can access the link in the YouTube description below.